The article showed me how important the support groups value input from the healthcare professionals, and for the meetings I've been to, it's really been the centerpiece of that day's meeting and has sparked loads of questions. So often it's a struggle to get away after a couple of hours, and I think that shows a great unmet need. One of the issues that I think men struggle with is that they read on, newspapers or on the internet or wherever of a new treatment or some breakthrough, but they don't have a place to reference it. So they really need somebody who could be a healthcare professional or maybe in the support group who can say, no, HIFU isn't as good as it sounds, or abiraterone's a great drug, but it's really only used for castrate-resistant prostate cancer. It's not suitable for somebody early on. So to help reference what they're reading in a place that's appropriate for their clinical stage. So your paper describes how the first thing they do for a new member is, what's your PSA, what's your Gleason? And I absolutely saw that and was quite surprised at seeing that. So the men are categorizing themselves into risk groups, which is exactly what the physicians are doing when they're coming to a treatment decision. But what was interesting in your paper were the anecdotes about the man who didn't know his Gleason and was forced to go away and find out and report back to the group. And you hear that in the questions. A man will put his hand up and say, I'm a PSA 8 Gleason 7. Now, if I was to describe a man as a PSA 8 Gleason 7, it would be disrespectful. So it's very interesting that they've already learnt that lingo and communicating in that way. The support groups typically comprise a diverse group, and in that group there will be ex-CEOs and businessmen whose job it has been to assimilate new information and to make a business decision about their work. And I think we see this coming across in the support groups. So somebody may say, hey, there's this great deal for Viagra on the internet, but the more savvy person there will say, well, are you sure it's not, are you sure it's genuine Viagra, or are you being had here? Or have you read about the side effects of HIFU, for example? The guys who are selling it are marketing it to make money. And so I've been surprised that there is, perhaps as a result of that diversity of skill sets, that there's been a very mature attitude to consumerism. The support groups are very strong on encouraging people to get multiple opinions about their treatments. And patients, I think, are sometimes unaware that there are options, or are unaware that it's their right to get second opinions from a different specialty, or even question the first advice that they get. The problem is that they may come to the support groups too late.